fever, headache, cough, acidity, allergies, diarrhea, or a minor cut. These common health problems can happen to anyone. But do you know which over-the-counter medicines may help? How to use them safely? And when you should stop self-medicating and see a doctor? In this video, we'll explore common illnesses and commonly available OTC medicines that can provide symptom relief. Plus important safety tips everyone should know before reaching for the medicine cabinet.
Common illnesses such as fever, headaches, the common cold, cough, sore throat, allergies, indigestion, diarrhea, constipation, and minor aches and pains can often be managed with over-the-counter OTC medicines. These medications are available without a prescription and are intended to provide temporary relief from mild symptoms. Common OTC medicines include paracetamol for pain and fever, ibuprofen for pain and inflammation, antihistamines such as cetirizine for allergies, antacids for heartburn, cough suppressants or expectorant for cough, and oral rehydration solution, ORS, to help prevent dehydration for diarrhea. While OTC medicines are generally safe when used as directed, they should be taken according to the recommended dosage under physician care, and users should read the label carefully for warnings, possible side effects, and drug interactions. Persistent, severe, or worsening symptoms require medical evaluation, and antibiotics should only be used when prescribed by a qualified healthcare professional. OTC medicines are designed to relieve symptoms, not necessarily cure the underlying cause of illness, making proper medical advice essential when symptoms do not improve.
A fever is a temporary rise in body temperature, usually as a sign that your body is fighting an infection caused by viruses or bacteria. A normal body temperature is around 37 degrees Celsius (98.6 degrees Fahrenheit), and a temperature of 38 degrees Celsius (100.4 degrees Fahrenheit) or higher is generally considered a fever. Fever is often accompanied by chills, sweating, headache, body aches, tiredness, and loss of appetite. In most cases, fever is not a disease itself but a symptom of an underlying illness such as a cold, flu, or other infection. Most mild fevers improve with plenty of rest, drinking enough fluids to prevent dehydration, wearing light clothing, and taking over-the-counter medicines such as paracetamol or ibuprofen, when appropriate, to reduce fever and relieve discomfort. Seek medical attention immediately if the fever is very high, lasts more than 2 to 3 days, is accompanied by severe headache, difficulty breathing, chest pain, persistent vomiting, confusion, seizures, a stiff neck, or if it occurs in a very young infant. Remember, treating the fever may make you feel better, but it is also important to identify and treat the underlying cause.
A headache is one of the most common health complaints and can range from a mild discomfort to severe pain. It may feel like a dull ache, a tight band around the head, or a throbbing pain on one or both sides. Common causes include stress, lack of sleep, dehydration, hunger, eye strain, sinus infections, excessive screen time, or illnesses such as the common cold or flu. Most headaches improve with rest, drinking plenty of water, eating a healthy meal if you have skipped one, reducing stress, and taking over-the-counter pain relievers such as paracetamol or ibuprofen, following the recommended dosage. Avoid taking painkillers too frequently, as overuse can sometimes lead to more headaches.
A sore throat is pain, irritation, or scratchiness in the throat that often becomes worse when swallowing. It is commonly caused by viral infections such as the common cold or flu, but it can also be caused by bacterial infections, allergies, dry air, smoking, or excessive use of the voice. A sore throat may be accompanied by a cough, runny nose, fever, swollen glands in the neck, or difficulty swallowing. Most sore throats caused by viruses improve within a few days with plenty of rest, drinking warm fluids, gargling with warm salt water, staying well hydrated, and using throat lozenges or over-the-counter pain relievers such as paracetamol or ibuprofen as directed. Antibiotics are not needed for most sore throats because they do not work against viral infections.
An allergy occurs when the body's immune system overreacts to a normally harmless substance, known as an allergen. Common allergens include pollen, dust mites, pet dander, certain foods, insect stings, and some medicines. Allergies can cause symptoms such as sneezing, a runny or blocked nose, itchy or watery eyes, skin rashes, hives, itching, or mild swelling. Most mild allergies can be managed by avoiding the trigger whenever possible and using over-the-counter antihistamines, such as Cetirizine or Loratadine, following the instructions on the label. Keeping your home clean, washing your hands after being outdoors, and showering after exposure to pollen can also help reduce symptoms. Common over-the-counter medicines for allergies include Cetirizine, helps relieve sneezing, runny nose, itching, and watery eyes. Loratadine provides relief from allergy symptoms and usually causes less drowsiness.
A cough is a natural reflex that helps clear the throat and airways of mucus, irritants, or infections. A dry cough may sometimes be relieved by cough suppressants such as dextromethorphan, while a wet or chesty cough with mucus may benefit from expectorants or mucolytics, such as guaifenesin or ambroxol, which help loosen mucus. Throat lozenges and warm fluids may also soothe throat irritation. Always read the label carefully, follow the recommended dose, and avoid combining multiple cough and cold medicines with the same ingredients. OTC medicines provide symptom relief but do not treat every underlying cause of cough. Seek medical attention if the cough lasts more than 2 to 3 weeks, or if it is associated with difficulty breathing, chest pain, coughing up blood, high fever, or worsening symptoms.
Diarrhea is a common condition in which a person passes loose, watery stools more frequently than usual. It is often caused by viral or bacterial infections, contaminated food or water, food intolerance, certain medications, or digestive disorders. Symptoms may include frequent bowel movements, abdominal cramps, bloating, nausea, and sometimes fever. The greatest concern with diarrhea is dehydration, which occurs when the body loses too much water and essential salts. Most cases are mild and improve within a few days. Treatment focuses on replacing lost fluids by drinking plenty of water, soups, and oral rehydration solution, ORS, while eating light foods such as rice, bananas, toast, and crackers. Good hand hygiene and safe food practices can help prevent diarrhea.
Constipation is a common condition in which a person has infrequent bowel movements or passes hard, dry stools that are difficult or painful to pass. It is often caused by not eating enough fiber, drinking too little water, lack of physical activity, ignoring the urge to have a bowel movement, certain medications, or changes in daily routine such as travel. People with constipation may experience bloating, abdominal discomfort, straining during bowel movements, or a feeling that the bowels have not emptied completely. Most cases improve by drinking plenty of water, eating fiber-rich foods such as fruits, vegetables, and whole grains, exercising regularly, and establishing a regular toilet routine. If needed, over-the-counter fiber supplements or mild laxatives may be used for a short time, following the instructions on the label.
A urinary tract infection, UTI, is an infection that affects any part of the urinary system, including the bladder, urethra, kidneys, or ureters. It is one of the most common bacterial infections, especially in women. UTIs are usually caused by bacteria entering the urinary tract, with Escherichia coli, E. coli, being the most common cause. Common symptoms include a burning sensation while urinating, frequent or urgent need to urinate, passing only small amounts of urine, cloudy or foul-smelling urine, lower abdominal discomfort, and sometimes blood in the urine. Drinking plenty of water may help flush bacteria for the urinary tract, but a UTI usually requires prescription antibiotics, so it is important to see a healthcare provider for proper diagnosis and treatment. Do not take antibiotics without a prescription or use leftover antibiotics, as this can lead to ineffective treatment and antibiotic resistance. Heartburn is a burning sensation in the chest or throat caused when stomach acid flows back into the food pipe. It may occur after heavy meals, spicy or fatty foods, lying down soon after eating, or certain lifestyle habits. Over-the-counter antacids can provide quick, short-term relief by neutralizing stomach acid. Medicine, such as antacid, may be appropriate for frequent symptoms but should be used according to the label or healthcare advice. Avoid overeating, identify foods that trigger symptoms, and avoid lying down immediately after meals. Seek medical attention for severe or persistent heartburn, difficulty swallowing, vomiting blood, black stools, unexplained weight loss, or chest pain, especially if it is associated with sweating, breathlessness, or pain spreading to the arm or jaw, as these may indicate a heart problem rather than simple heartburn.
Motion sickness occurs when the brain receives conflicting signals from the eyes and the inner ear during travel by car, bus, boat, or airplane. Can cause nausea, vomiting, dizziness, sweating, and headache. Over-the-counter medicines such as dihydrogenate may help prevent or relieve motion sickness when taken as directed, usually before travel. However, these medicines can cause drowsiness, so avoid driving or operating machinery after taking them. Sitting where motion is least noticeable, looking at the horizon, getting fresh air, and avoiding heavy meals before travel may also help. Seek medical advice if vomiting is severe or persistent, or if symptoms continue even when you are not traveling.
Mild burns, such as minor first-degree burns, can cause redness, pain, and mild swelling. Immediately cool the affected area under cool, running water for about 20 minutes. Do not use ice, butter, or toothpaste. Over-the-counter options, such as burn gels or aloe vera gel, may help soothe minor burns, while paracetamol or ibuprofen may help relieve pain when appropriate. Cover the area loosely with a clean, sterile, non-stick dressing and do not burst blisters. Seek medical attention if the burn is deep, larger than the person's palm, located on the face, hands, feet, genitals, or over a major joint, or if it was caused by electricity or chemicals. Also seek care if there are signs of infection, such as increasing redness, swelling, pus, or fever.
Minor cuts and scrapes are common injuries that can usually be managed at home. First, wash your hands and gently clean the wound with clean running water to remove dirt. Apply gentle pressure with clean gauze or a cloth to stop bleeding. An over-the-counter antiseptic may be used according to the product instructions, and the wound can be covered with a clean adhesive bandage or sterile dressing to protect it while it heals. Avoid repeatedly using harsh chemicals that may irritate the tissue. Seek medical attention if bleeding does not stop after applying firm pressure, the cut is deep or widely open, caused by a bite or dirty/rusty object, contains embedded debris, or shows signs of infection such as increasing redness, swelling, warmth, pus, or fever. Also check whether a tetanus booster may be needed.